Hey everybody, it's Sherry Tutkus, the Green Nurse, and I am here to talk about the National Council State Boards of Nursing and to provide you some information on why you want to explore the Green Nurse community, mentorship, and patient community. So the National Council State Boards of Nursing is a nonprofit whose United States members include the nursing regulatory bodies in 50 states, the District of Columbia, and 4 United States territories. It was created to bring together nursing regulatory bodies to act and counsel together on matters of common interest, and it has evolved into one of the leading voices of nursing regulation across the world. The mission of the National Council State Boards of Nursing empowers and supports nursing regulators in their mandate to protect the public. Their vision is leading regulatory excellence worldwide. So in 2018, the National Council State Boards of Nursing put out guidelines in the Journal of Nursing Regulations for medical cannabis. They identified 6 principles of essential knowledge about cannabis for nurses, advanced practice nurses, and nursing students. 1, the nurse shall have working knowledge of the current state of legislation of medical and recreational cannabis use. 2, the nurse shall have working knowledge of the jurisdiction's medical marijuana programs. 3, the nurse shall have an understanding of the endocannabinoid system, cannabinoid receptors, cannabinoids, and the interactions between them. 4, the nurse shall have an understanding of cannabis pharmacology and the research associated with the medical use of cannabis. 5, the nurse shall be able to identify the safety considerations for patient use of cannabis. And 6, the most important of all, the nurse shall approach the patient without judgment regarding the patient's choice of treatment or preferences in managing pain and other distressing symptoms. So why is this important? Well, if you are a health professional, a medical professional, a nurse, an advanced practice nurse, a nurse practitioner, a nursing student, you have an obligation to learn about the endocannabinoid system. The endocannabinoid system is the largest neuroregulatory system in our body. It regulates all 11 organ systems, our immune system, and all the neurotransmitter signaling systems that give messages to tell our body to do something or not do something. So here's the issue. If we're not producing enough of our own cannabinoids, what happens is that our bodies start to become dysregulated and we become out of balance. And then we start to develop symptoms, and that's when illnesses start to creep in. So as health professionals, we have an obligation to learn about the endocannabinoid system because every single thing that we tell our patient to do or not do affects that system. So if you're new to the cannabis world, if you're a licensed health professional or a nurse and you're interested, come visit us at www.thegreennurse.com and check out our mentorship program and our community. Come on the bus. We're for sure here to help you be educated and empowered to utilize cannabis education in your practice. And we will definitely bring you hope and inspiration for growth and healing. And remember what it's all about. It's about living your best life and helping your patients to do the same. Happy Sunday, fun day.